Welcome to the Health Science Coach Podcast. My name is Drew Garner, and I'm a health science and physical education teacher. This is a podcast to help students, parents, and recent graduates learn about pathways into healthcare and sports medicine careers. These industry professionals lay out how their experiences have helped them get to where they are now. If you enjoy this content, please subscribe to the channel or download through your podcast player. Thanks again for spending some time with us today. Now let's dig in. All right, today we get the pleasure of meeting with David Hersch. He is a healthcare IT manager for Wipfli LLP. David, how are we doing today?
Hey, what's up, Drew? I'm doing great. How are you?
Doing great also. We just got done talking about the weather and the golf. You got a lot of golf paraphernalia in your background, some special golf equipment and stuff there for you. We'll get into that a little bit. Yep, you got your clubs, your home golf office room. And we'll get into the importance of that here coming up. So you're in healthcare IT. Can you give us a little detail of what about it means to work in a department such as healthcare IT?
Well, the industry is crazy and ever changing, but so I think I got into this through Cerner. I had friends that worked for Cerner here in Kansas City, and Cerner was my first job out of school from Iowa. So I got lured into working in computers. I loved computers. I mean, I'll be perfectly honest with you. In 8th grade, I think we got one of our first computers, and my grades went down because I was playing on computers too much, which is, I guess, probably a bad thing at the time, but a good thing going forward.
Right.
So I knew that if I could combine my love for computers and maybe mix it into what they were doing in hospitals or doctors' offices or anything that we were doing with healthcare, it would be a neat intersection. So that's how I first got into it. And of course, it was a decently compensated position. So that was also attractive.
Yeah, absolutely. So you studied marketing and at University of Iowa and business management administration. You played D1 golf there as well, which is kind of cool. So what was your experience, playing golf at that level as well as going to school?
It was hard. Don't get me wrong. It was hard because playing a sport at a Division I, Big Ten level, I'm not going to joke with you. It's a job. At the high school level, we would just play one season. Like where I was from in Nebraska, you'd play one season in the spring, and you'd have practice for a couple hours after school. You go play 9 holes, whatever, and then you'd have one tournament each week, which was, throw out a number, 8 tournaments, before the end of school or whatever. And that was it. That was your year. That was the season. At the college level, you play both fall and spring. You have practices just about every day. There's qualifying because your position is never secure. And then during the winter, on top of that, you have conditioning, which is basically you're mandatory to go to the weight room, the exercise room. I almost think it was like 3 to 5 times a week. So it is required of a student athlete on top of going to all their classes, keeping up those hours, and of course the homework and all the different traveling if you are one of the top 5 players on the team. So yeah, it's big.
Yeah,
a lot of work.
That's pretty cool to be able to do that as well as earn your degree from there.
Thanks.
While you're there, you played golf. What did golf kind of help you with along the way of learning how to conduct yourself professionally and kind of build into what you've been able to take away from golf that's helped you with your professional career?
I'll give you a great example: time management. And I have a great example of that because this was before cell phone days, right? Before you had your calendar on your phone or on your computer. I mean, I was jotting notes down in your student planner all the time. But here's a funny example. I had a brother that I had that had a birthday. I believe it was on a Monday. And, you got those little time windows that you could get. He was a younger brother, so you had to call him before bedtime, but, after school. I was not able, with all the time management, homework, group studies, golf, classes, all that stuff. I was not able to call him until Friday because of all the different things that were going on. So time management is very key that you're going to learn in college going forward, that you're going to use as a tool organizationally in your profession.
Right. Absolutely. So after graduating, we kind of talked about you jumping in right with Cerner and finding your love for computers and working with the healthcare industry right there. You spent a lot of that time working with different companies, 11 different companies throughout your professional career, 9 of them in the healthcare industry. And 2 of them were kind of, at the beginning of your career, you spent a year with the Cubs and then a year working in banks. What kind of wanted you to get some different experiences, and what did you learn from those 2 different experiences that have inevitably led you back to working in healthcare?
Oh man, that is a great question. I think everybody's got a journey, right? So my journey out of school led me to Cerner because of friends, because of networking, right? You got the opportunity to get an interview, and Cerner needed people, so I moved to Kansas City. But always in the back of my head, because I was in sports at school, and this is for another conversation when I can give you the whole Cubs job and being able to land that. But that's a cool inspirational story if any of your students want to hear that sometime, because it might give them an opportunity. But I knew I wanted to get into sports and I wanted to dabble into it. And long story short, I was able to land a job as an account executive with the Chicago Cubs. And anybody that knows, basically an account executive is a salesperson. So I was in sales in sponsorship. So basically, we were the ones that sold the Pepsi bobbleheads or your Budweiser keychains or anything that had a giveaway or a sign or whatever at the Cubs. So I was in sales. I went from working with computers and people, but not having to sell it, we were implementing it, to being on the front line and driving revenue, right? It was an opportunity to try something different. So that lasted 2 seasons. And I'll give you the reasons why that lasted only 2 seasons. Okay, there was very minimal people in the organization. There were 65 people in the front office of the Cubs. So there was not a big opportunity to move up. If you wanted to move up, you had to move out. And since I was so passionate about the Cubs and Chicago, I wasn't exactly going to go to the White Sox or the Bulls or a media outlet or whatever. There was very little pay in the organization. So anybody would give their right arm, of course, to have the position that I did. So of course they could, with supply and demand, they would be able to keep the wages down. And the third reason was you were working ungodly hours. If the team was in town 10 days in a row, you were there 10 days in a row. And if you want to give an example to any of your folks that are interested in sports, I'm just being honest with you. It's in baseball, it's like organizing 81 weddings a year because there's 81 home games. So if you like organizing 81 weddings that are sometimes back to back to back to back to back to back to back, hey, it's for you. But if not, be a fan. Just letting you know, be a fan. But here, I'll give you my little journey. Okay, in short, I had an account at the Cubs that was Cole Taylor Bank. Okay. And they needed somebody that had marketing and also system analytics background. So I had the computers. I was working for the Cubs, so I had the marketing. And oh, by the way, if they're going to show you a little bit more compensation and a little less, hours, because I was working crazy hours. Okay, yeah, then now is the opportunity to make the jump. So I worked at the bank. Had a friend that I kept in touch with when I was at the bank that was also working for the hospital downtown Chicago. And then eventually talks led to, hey, we could use another analyst like you. And that led me back into healthcare. So I was working, I got back into working as a Cerner analyst in downtown Chicago at one of the biggest hospitals in Chicago. And what I guess the theme of this whole journey is keep building those bridges and keep up with your network, because my network, one of the people that I knew at the hospital in downtown Chicago worked for a consulting company. And of
Okay.
course, at a consulting company, they're going to be traveling a little bit more. But with travel and short term, I'll call them projects, there's a little more risk involved because you may not have that full time position, right? So you might be working from gig to gig to gig, and that's what I learned in that opportunity. But with a little more risk, they're going to also offer you a little more compensation. So made the jump. It was time to make the move. We didn't have kids. Amy and I were just starting our lives together in downtown Chicago, so I was able to travel and did that for a couple years in the consulting world. And now that was not sales. So I was like, dang, I'm missing a little of the sales stuff from the Cubs. So I wanted to marry the two eventually. And that's how I got into consulting sales, where I was taking advantage of being able to speak the language of the intricacies of healthcare, but then also understand what the client needed as far as resources goes. And that's where I was able to get back into the consulting sales model of before going back to Cerner and eventually, where we connected because I moved back to Kansas City here for that.
Absolutely. And in that time, you kind of made your way down to Georgia for a little bit. Studied at Augusta State University and got your master's in business administration. What kind of led to wanting to go back and getting your master's?
That's a great question. So my wife challenged me on that one. And I'll tell you, that was one of the most challenging times of our lives because I was working full time.
Right.
Amy said, I'm going to go back and get my master's. Why don't you go back and see if you can get your MBA? I said, okay. And oh, by the way, throw a kid into the situation. So, we just had Chloe and she was a 1-year-old. So I'm sitting here trying to work full time, study at night because we usually had night classes and sometimes on the weekends. And then, you're taking care of a 1-year-old. But I knew that the graduate level degree was going to help down the road. Right. And the CIO, which is the Chief Information Officer of the hospital that I worked for in Augusta, said there's no better time than now. You just got to do it because if you put it off, you're going to put it off forever. And on top of that, if you have the opportunity where your business that you work at will help pay for some tuition, take advantage of that. That's where
I think that's reimbursement. Big key things to find out if you're able to take advantage of something like that, where they're able to help with the compensation part and aspect. I think that's a big key thing that a lot of younger adults should look into as well.
And if you do that as a student, if you can go into the workforce and then come back, not only do you bring your experience back to the classroom, which is easier to do the work, the businesses usually will love that and help pay for it.
Yeah, absolutely. So after that stint down there, you kind of, like you said, moved back to Kansas City and started working with Cerner again for the second or third time, I guess, technically.
Second time. You're right. Second time.
So then you just got your job now as a project manager for electronic healthcare record systems and implementations in hospitals. Let's talk a little bit about what your role is as far as healthcare information records and how you implement them within the hospital systems.
Yeah, sure. So the way I found this position too is this is an interesting one about building bridges too. I was working for Cerner as a project manager, and what we would do is we would work with hospitals that are about 100 beds or less and implement Cerner's solutions, basically their software. And to make the analogy is picture Microsoft Office with Word and Excel and PowerPoint and all the different solutions that work within Office. We do that with Cerner solutions, whether it goes in the radiology department, the pharmacy, materials management, whatever, and they all work together. And so that led me to meet a gentleman that was on a client site to the position that I have now. And so what we do is we project manage from the client's perspective. So we're on the client, we're representing the client side now, not necessarily Cerner, who is the vendor. Right. We make sure that project stays on task. We help mitigate risk. We help deal with resources because, people are changing all the time. We
Hmm.
help with the communication plan because sometimes um, people learn and get information in different ways, whether it be email or postings in the break room or podcasts or community advisements. There's a
Right.
whole bit of different things, a whole lot of moving parts. So that's what we're doing on a daily basis.
So then, are you in the hospitals individually? Okay. So
Oh
then,
yeah.
while you're in the hospital, who are you having those one-on-one conversations with specifically? Is it a nurse manager, a physician, a hospital manager, or how does that kind of all
Sure.
work out?
It usually starts at the C-suite level. And what I mean by that is it's either the chief information officer, the chief financial officer, sometimes the CEO, the chief executive officer. It'll start with that level, to make sure that we're all on the same page. But
Right.
then if you're roaming around, you know me, I like talking to anybody. So I will talk to anybody from an end user who could be a nurse, a care provider,
Yep.
a doctor that's having trouble entering their note. I could talk to somebody in materials management that's having trouble scanning an item, to make sure it's in the system. So a care provider could use that saline solution or use that Tylenol or those crutches or whatever.
Right.
So I keep the door open to talk to anybody.
Yeah. Okay. So that makes a lot of sense. So then, with the electronic records, um, what are they able to use them like specifically for? We talk about them in class a little bit,
Sure.
and showing how they're used. And at the end of the semester, we'll do a project with Cerner's First Hands or Charitable Foundation, where
Oh, nice.
we have a patient, a digital patient, and we'll take them in and read through all of their information. One of our students will be the nurse and input the data into our healthcare system data.
That's great.
How does that user interface work for the professionals in real life settings, whether it's going from x-ray to pharmacist to the nurse to the physician? How are they able to seamlessly use those products and kind of help the patient through that?
From the Cerner perspective, I'll give you a great example. We have a video that's called "A Day in the Life of a Patient." So, say this patient goes and is reporting some pain, maybe down here in their abdomen area. So they go see the doctor. It's not getting any better. In fact, throughout the day, it's getting worse. So not only do they go from, okay, so you're going to the physician's clinic, like you're going to get your annual physical or something like that. So the doctor could call ahead from the physician's office and say, I got somebody coming down to the emergency department because it could be, an appendectomy, could be
Yep.
could be trouble in the appendage area there. Yep. So I want you to take a look. Sure enough, okay, so if that doctor's office is using Cerner, and then the hospital system is using Cerner, it's all seamless. They know exactly what's going on. They know what meds he or she is taking. They know if they've been pregnant. They know their vitals already. So it's instant. Everything transfers over seamlessly.
Right.
So from there, if unfortunately they have to have some surgery, they can go instantly. The surgeon can see what's going on. They know what's being seen as far as the X-rays, the CAT scans, the pharmacy, the meds that this particular patient is on. And then from there, if they're discharged, they go home with the discharge instructions that are all right from FirstNet, and they have everything that they would need to come back to that physician's office, all right there, all ready to go, tracking the patient with the notes and everything. So it's
Yeah.
all in one record instead of somebody's binder that they're trying to pass along
Right.
to look for that information.
Yeah, absolutely. So your passion for healthcare and IT, throughout your career has really come out strong, working with all these different companies and being able to help implement different programs. What what do you love about being able to do this as your career?
I think what's really cool is you help to see patients get better. It's all about patient care. And if we could, I look at it like this. Okay, we say the word healthcare,
Right.
but it's really sick care. What are we doing when we go to the hospital or when we go see the doctor?
Yeah.
It's you're sick. Like if you and I are healthy right now, we don't want to do that. We don't want to go see the doctor for the heck of it. So if you flip it on its head wouldn't we really love to know if the next donut that you eat could be causing you to have diabetes? Or if you go take a run later that day, it could be helping to extend your lifespan by X number of minutes.
Yeah.
All with this digital technology, and by keeping even like a Fitbit like this, it's tracking, and it could be, people say that, oh my gosh, I'm being invaded. But if you look at it on a positive sense, it could really be helping you to lead a healthier life. And I think that's what the goal is. So I really love the way that the digital mainframe platform is being able to help us live better lives. I think it's
Yeah,
cool.
absolutely. I read an article last week about a nurse with her Apple Watch 7 that was detecting some information about her and saying, hey, here's some symptoms that you could be seeing, and here's XYZ, a week before her doctor was able to diagnose her with what was going on. So I think with a lot of that information that's going to be, 5, 7, 10 years down the road, I think we're going to see a lot more of that, of the health or well care versus the health care or sick care. Yeah.
Sick care. That's exactly right.
What are some misconceptions you think there might be out there about healthcare information technology positions?
Positions in general that could be misguiding or misleading. I think it could be that there's not enough information out there, and there could be some information that could be guiding people in different directions. So, you always want to make sure that you're getting information from different places.
Right.
And then you might want to check to see if the source is coming from the right place, or you're talking to the right people about that information.
Mm-hmm.
You always want to make sure that, like I said, make sure that network is solid. And if you don't, always question it. I think that could be a good tip for someone down the field. If your gut's telling you something's off here, it probably is.
Yeah, absolutely. So over your career working in healthcare, what is something that you're most proud of being able to achieve?
Most proud of being able to achieve in healthcare. Um,
Or sales,
gosh,
business, just
no,
general profession.
Um, I think it's being able to build upon what you have learned in your journey, take our parents' generation for example, where they may have worked at one position for their entire lifetime. And what we have done in our generation is, worked at many different jobs and been able to take that experience and build upon it. Now, would I like Wipfli to be my last position that I work for? Absolutely. I'm loving it. I'm loving the support network. The people that are engaging and encouraging are absolutely amazing. But if something changes, if something out there is better that comes along, I hope to be able to take this learning experience and be able to use it to the next one. But right now, I'm loving what I'm doing at Wipfli. So,
Absolutely. And that
yeah.
I completely agree with that. By taking your experiences and being able to build upon all your different things, you're adding tools to your toolbox of being able to have the experience and share that information later on down the road. So with building on your experiences and all that throughout your career, is there anything you wish you would have done maybe in the past that you weren't able to do, or wish you would have done earlier?
Wish I would have done earlier. I maybe would have wished I would have stayed at the Cubs a little bit longer just to see if things would have worked out in a different way. But things worked out great in the way they did by moving to the bank and then moving to Northwestern. There's a whole bunch of hearsays or what I would have done it differently in this shape or manner. You can't go back and change too many things.
Right.
So I'm very, very happy the way things are right now. So.
Absolutely. So with education and with people in healthcare, a lot of people have professional development that you have to do, and you hit on a little bit earlier that within the healthcare systems, everything is always adapting and changing and getting more technological.
Yeah, technological. There you go.
What is some of the professional development that you do as a implementer of healthcare systems, and some of the industry trends you see within that professional development?
I wonder if you were talking to one of my managers, because this is something that just came up on one of our calls.
There you go.
Yeah. So I'm on a monthly call with our healthcare community to talk about trends and things. And I think the best thing you can do now is work smarter and not work harder. And what I mean by that is there's several blogs out there that I follow in our field, one of which is Becker's Hospital Review. Another one is his talk, which is Health Information Systems Talk, and they're websites, but they have communications that are sent to me. I don't necessarily have to go browse their websites.
Right.
So if they send information to me, I can skim over that information and be able to decipher which is good information to send out to my colleagues and which to just, put into the circular file. So by looking at those trends, I'm able to be the technology liaison to our team and be able to say, here's some things that I've seen that could be coming down the pipeline in 2022. Here's some risks. Here's some stuff to avoid. If you hear these things in your conversations when you're talking to your C-suite, to your tax advisors or the board of directors, and they say something like this, red flag go up. Hey, talk to Dave. That might not be right. So those are the kind of things that we look out for.
Yeah, absolutely. So, you've said you love what you're doing now. Everything's going great. What are some career goals that you have set for yourself for maybe next 5-10 years down the road?
Well, I'd like to move up within the organization. Yeah. And there are opportunities to do that. Right now, I'm at the manager level. There's, okay, of course, an opportunity to be at the senior manager level. And then after that is the partner level. And what I'd like to do in, the 5 to 10 year plan is to get to that partner level. And whether that means bringing new resources into the organization, bringing net new clients into the organization, bringing new concepts or ideas, or even tweaking some. If you see something, Wipfli's always up to the opportunity. If there is a process within the organization that could be altered or optimized, yeah, they love that. That is very well looked upon and very well valued within the company. So those are things that can help you re-engage and move up within the organization.
Yeah, yep, absolutely. Is there anything you wish you would have known in high school, like looking back now, wish you would have known in high school or maybe early on in college that would help you with your career right now?
Wow, things have changed so much. Oh. I would just say make sure that you are, here's a basic one. Within your network of friends, know what their parents do. Just basically know what people's parents do for their work. And, that way you can organize and figure out in your head, hey, so-and-so does this, so-and-so does that. Maybe they have a connection here. Maybe they know somebody. It's all about building your network and not necessarily building the letters behind your name, depending on what field you're going into. But if you can reach out and know that, hey, Johnny's parents do this or Mary's parents do that, and Johnny has a friend over here that does this, it's all about building that network. I would suggest doing that.
Yeah, I like that a lot. I mean, and it kind of helps too, if you have an idea of, okay, I want to be a nurse. Okay, well, Johnny's mom's a nurse. I can go talk to her about what she did. Oh, no, I definitely don't want to be a nurse now because of it's learning about this experience. I like that a lot.
I would have never known if I did not want to leave the Cubs if I didn't get a job with the Cubs. How would you have known? So that's right. The thing. Yeah,
absolutely. So this next one kind of bounces off of that, and it's kind of a 4-part question. So you had mentioned earlier, 8th grade is when you really started figuring out you had a passion for computers and technology interest. So if I have a high school, sophomore, junior, senior that's really into computers, really into that type of stuff, that thinks they may want to be getting into healthcare IT or something in that type of field, what would be some information or stuff that you would want advice to give them
Oh,
to during
absolutely.
that time frame?
I mean, within Kansas City alone, there's multiple organizations. Obviously, Cerner being the big one, WellSky, NetSuite. All of these organizations are always looking for interns or anything to do on the side to help get within the organization. And at the high school level, it could be as minimal as getting coffee for somebody or
Yep.
pushing papers or being a runner. Um, that is getting to know the organization, getting to know the logo, getting to know the people. That's how you get in and being able to put stuff in on your resume or on your CV.
Yeah,
That's
absolutely.
what I would do. Forward those people that are interested in things websites to just start browsing around and reaching out. Yep.
So after high school, that college undergraduate student, they're studying. They're doing some of their basic information right now. Their lower level classes. Once again, a sophomore, junior in college that has done some of that internship or done some of that paper pushing. That still is being passionate about getting into healthcare IT. What are some things that they could be working on to build themselves or build their resume?
Absolutely. I would say reach out to any one of, if they're at school, whether it's University of Kansas, K-State, Johnson County Community College, wherever, all those counselors and career departments have either career days or they have businesses come in to give a presentation. Anything that you can get out there and meet these companies, they love it. That's how the University of Iowa had a career day, and the person that I knew was coming back to Iowa that was with Cerner. Start meeting them, start having conversations. That's how you do it, and you stay within the computers. Like when I was studying management information systems at Iowa, we weren't doing anything with electronic medical records there. But since we had the understanding of the terms, what are you doing with a domain? How does that particular byte fit with that bit? If you can talk the language,
Yep.
it gets you one step further. So yeah,
Yep.
I would reach out to those counselors and career days.
Absolutely. And then advice for someone that is getting ready to graduate. Say they're, 6 months away, 4 months away from graduating. What are things that they should be looking at as far as, maybe applying for jobs or companies to be looking for? They're getting ready to get out in the real world. We don't want them to wait until, they graduate to start applying.
Yep.
What is some advice you would have for them?
I would say put together that resume and have somebody look over it. Make sure, it doesn't have to be anything long, but definitely something with some experience that catches somebody's eye. And I'll give you a perfect example. Something that's actually framed is a resume on the side of my wall that I gave to the Cubs. It's something that I put together that looks like the Cubs scoreboard, and I took my resume and I cut and pasted. That made it look unique. That made it stand out. If you can make yourself stand out, I'll give you another example. When I was at my MBA school down in Augusta, Georgia, guy was doing the same thing. He was getting ready to get out of school and looking for a job. Now, what's in Augusta, Georgia? The Masters.
Yep.
So, and who goes to the Masters? Pretty people that are in high positions in different organizations. So he dressed up in a suit, he had his resume, and he went to where people were lining up to go into the Masters.
Okay.
So what's he doing? He's got a suit. He looks like he's handing out. He's looking, like he's panhandling, but he was not. He was looking for a job, and that was unique. And he got him on the news, and he was handing out jobs. And sure enough, he got a couple interviews out of it. So moral of the story is be unique. And if you need advice for doing that, reach out to us. Do something different, make yourself stand out.
I like both of those stories a lot. That's pretty
Yeah.
interesting, being able to have that intuition of, hey, these are where all the big wigs are going to be. Let's show up and, have your resume, start handing it out, trying to just start building that network from there.
He wasn't selling him. He wasn't selling any items or anything. He was selling himself, and it worked.
Yeah.
Yeah.
Absolutely. So let's take the person that's graduated from a healthcare IT program. They have a job. They're been working in their job for 3 to 6 months. What's advice for them that you may have? So somebody that's been in the career already, they're just getting their feet wet. They're learning all the ropes with their company. Advice for them.
I would say the best thing to do is soak up anything your manager can let you do. And the best way, one of the best lines that I've heard was from a previous manager is every once in a while, kindly send an email or during your one-on-one with that manager, say, hey, what can I take off your plate? I know you're busy. What can I do for you? Is there something that's bogging you down that I can help you out with? If you ask your superior what you can help them with to make their life easier, win-win.
Yeah, absolutely. I could definitely see how that would help. So then if we're looking for something to read, maybe about sales or marketing or job experience, do you have any books that you would recommend somebody, maybe a high school or college age student to read to kind of see if that's something that's still their passion?
Yeah, sure. One of the things that I picked up recently, I get books and book advice on podcasts that I listen to. I'm always walking, you knew when I was walking in the neighborhood.
Yep.
I'm always listening to things. And then sometimes they'll have books that you can pick up based upon what you're listening to. I listened to a good one recently suggesting a book by Coach K, Mike Krzyzewski from Duke. And it was intertwining his coaching knowledge with leadership. So it wasn't necessarily based on anyone's industry. It was all on being able to take advice, process it, and apply it to your industry. And I found it very interesting on leadership. So that's what I'm enjoying, and I recommend that to anybody that's interested in sports and leadership.
Yeah, absolutely. I think that's pretty cool. So then this is a two-part question, I guess. If you dislike blank, then being in healthcare information technology is not for you. And if you do like blank, then being in healthcare IT is the right career path for you. So our athletic trainer put it like this: if you don't like feet, then being an athletic trainer is not for you. You're going to be spending time wrapping ankles, that kind of stuff. So if you dislike blank, healthcare IT is not the career path for you.
If you dislike crazy hours, computers, if you dislike people that are impatient when technology doesn't work, because you're always going to have an end user going, I swear this doesn't work. I swear this doesn't work. Da, 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 da. I got to get this done. I got to get back to the patient. Blah, 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 blah. If you dislike that kind of stuff, healthcare IT is not for you. But if you don't mind travel and the company paying for it, if you don't mind some crazy hours once in a while, because trust me, I have spent many a night in the ED overnight shifts where, I will not kid you, where people have come to find Bob, I'm just throwing out a name, right? Bob was in the ED because Bob got into a bar fight and people were coming to finish the job. And you had to turn these people away because we don't know who Bob is or where he is. Then healthcare IT is not for you.
That's kind of an odd story, but something that could definitely happen based upon
real life. It happens.
Yeah, based upon how that all works. So then, if fill in the blank again, opposite direction of that, if you do like blank, then healthcare IT might be the right career path for you.
Oh man, if you like change, healthcare IT is for you. If you like traveling, if you like getting to know people and networking more. Perfect example is some of the accounts and relationships that I have gained through my Cerner job. I have been able to take to this position at Wipfli and potentially get more business. So
Right.
if you like building relationships, travel, technology, and meshing all of those, healthcare IT is for you.
Absolutely. I like that. And then last one, of course, thank you so much for your time. What is a mantra or quote that you try to live your work life by?
Oh man, I've got a couple. Those are good ones. There's one by Frederick Douglass that I heard on a movie a long time ago. Without struggle, there is no progress, because you're always going to struggle, and without struggle, you're not going to progress. And I always like this one. If you're going to oppose, propose. I don't want to hear a nagger. I don't want to hear whining. I don't want to hear something that's wrong. If you find something that's wrong, come with a solution.
Yep.
And I don't care what solution it is. Come with an idea.
Mm-hmm.
If you're going to oppose it, propose something.
I like that. That's an
those.
easy, quick way to have that little switch. Oppose and propose. That's a good one.
Yeah. If something's not right, well, okay. Well, what will make it right? Give me an idea. Give me a solution. I don't want to hear just whining.
Absolutely.
Not going to get us anywhere.
Well, Dave, thank you so much for your time today and spending it with us and sharing your information and resources about your career and path and how you got to where you are, and really hitting home that networking, I think, is a big key element of a lot of experience and what kids should be looking at.
If any of your students want to go through me and have questions, want to contact me, I'm always available. I will be glad to speak to anybody that wants some advice on healthcare IT, the Cubs, which you can see on my wall, or playing Division I athletics, or the whole mess of that. So anything, yeah.
Well, thank you so much again.
Bet. Anytime. Take care, Drew.
If you've made it this far into the episode, I want to thank you again for watching. Please subscribe, share, and comment below with any questions or comments you may have. If you're interested in more information about other professions within healthcare careers, please visit healthsciencecoach.com and talk to your school counselor or academic advisor. As always, stay happy, healthy, and live life with passion.